Right.
I'm prepared today.
Look at you. I do
Oh,
like
Megan's
your
here.
glasses, though.
Good morning. Good morning. Welcome. You're on mute.
Good morning.
Good morning.
Tasha, you look like you've had more coffee than I have this morning.
I've been up since 4 o'clock studying the rules. Actually, I've been reviewing the rules for like a week now, and then the changes that the commissioner had put out. So, like, I'm on it, guys.
This is my totally shocked face.
No, we all know that I geek out on that. Come on now.
I love it.
I do too. It keeps me busy and out of trouble. Raquel's supposed to be logging in.
No worries.
Oh, there she is.
Good morning, Raquel.
Good morning, Madam Chair.
Let me see here.
I'm stuffing my face.
That's fine.
Good morning, everyone.
Good morning. Raquel, I got to spend some time with your people last night.
How'd that go?
It was great. It was so good.
I have great humans in my life.
You do have great humans.
I have a great team.
Gladiators.
Gladiators.
Yep. I have a question for you. I noticed on the invites for like the face-to-face, October 3rd got changed from Fort Collins down to Colorado Springs. Is that correct?
Wait, what?
Okay.
No, I think so Tasha, there's two different things. So there's the community conversations with the commissioner. So that's in Fort Collins on the 3rd.
At night, right?
Yeah, those are all at 5 o'clock. And then the presentation that we'll have today on the rules, those are different. So that's probably the one that's in Colorado Springs. Some of them are on the same days.
Okay. I was just a little confused by that. So I just wanted to clarify because I am networking both regions or both.
Yeah. So rules will be in Colorado Springs. Commissioner will be in Fort Collins on the 3rd.
So all providers should be, I should send that to providers, correct? And community.
Yeah, I mean, both of those things.
Everybody?
So yeah.
Okay.
So the one with commissioner, yes, we want community and providers there. The one for the rules, the same, but they're in different regions. So it would be, it's different people that would be attending different ones.
Right. No, but my providers for behavioral health are in El Paso County. And so
send them that one.
Yeah. So I'm doing both places. So,
thank you.
You're welcome. Thank you.
So Raquel and Tasha, I just dropped the chat I just dropped the agenda in the chat. Wanted to make sure that you all felt comfortable with this. Kind of what we're thinking is you all designate, the roll call to order, meeting overview, and kind of follow through this agenda when we're speaking. And then when it comes for the formal vote of chair and vice chair, I'll just take that back to make that motion since it's for you too. And then I can speak to some of the BHAAC business a little bit more. And then we'll take that break and have kick it back over to you all to introduce Ryan and that slide deck as well, if that works.
I have a question, just clarifying question. Caitlin, can you put a motion on the floor or does someone else have to put a motion on the floor?
I'll just ask for somebody
the vote.
I'll just ask for it.
Okay.
I won't make the motion at all. I'll just be like, would somebody like to make motions? And then you all will make those motions. So that is all I will do there.
I'm nervous.
You got this. I did want to give you both a heads up. I have to jump off at 10. So I'll do the beginning of the meeting with you, and then Kelly Cossey will help support Caitlin from there.
Awesome. Thank you.
Alrighty. Good morning, everybody.
Good morning.
Top of the morning to you.
I think we'll give it a few minutes for folks to jump on.
Sounds good.
Good morning, everyone. Good morning, Kelly.
Good
Hello,
morning.
Maria. Good morning, Carolyn. I see you, Jamie, Shane, Ashley.
Caitlin, I can't tell if the interpreters are in the attendees. I don't have their names.
Yes, let me.
Here, if you are an interpreter, please put your name in the chat so we can move you to a panelist.
Good morning, everybody.
Could you actually raise your hand virtually because the chat is disabled?
Or you can put it in the Q&A too. That should be good. But yes, thank you for calling that out, Caitlin.
I also just messaged Stephanie just to make sure with the name. All right. For some reason, Renly got added as an attendee. Let me see here. Renly, I'm trying to promote you to a panelist. Okay, there we go. Kept giving me an error code there for a second. I was like, oh. Good morning.
Okay, I'm not seeing.
Yes, I just messaged Stephanie again.
Oh, is that Claudia? It says Claudia Bergstaller. I'm not sure if that's the interpreter.
I have a question right quick. Are council members allowed to join? Bosses haven't been picked yet, have they? Because I know there's a few council members that.
What's your question?
With the bosses haven't been picked yet, correct?
Hey, Michelle, this is Rob from BHAAC Athlete. My number is 719-717-0690.
Thanks, Dr. Rob. That made me laugh. Huh, break the ice. All right. Bosses haven't been selected yet, so
Tasha,
council
I
members-
hear what you're going to, and I'll just ask for you to not share any information about
No.
that. And
Right,
we'll make sure we do the formal process for how we do all of that.
okay, I was just
Saw where
wondering
you were
about council
going.
members. Just
Yeah.
council members, if they were allowed to join in yet or not, since, yeah.
Okay, I think we will go ahead and get started, and hopefully we will have our interpreter with us shortly.
Yes, I'm trying to go through my inbox and I'm not seeing that. So I just messaged Stephanie Bush. So as soon as she
She is
back
in a
to
meeting
me.
with the commissioner right now,
Okay.
so she may not be able to answer.
We will get those up and running as soon as we can.
Okay, let's go ahead and get started. I'll share the information, and then once we have the interpreters, folks can follow those guidelines. Caitlin, do you mind moving it to the next? Okay, perfect. Good morning, everyone. Welcome to our BHAAC meeting. I am Megan Shelton, Division Director of Intergovernmental and Community Engagement at BHA. I go by she, her, hers. And BHA friends, would you like to quickly introduce yourselves?
I'm Kelly Cossey, Deputy Commissioner. I go by she, her, hers, and I'll pass it over to Caitlin.
Morning, everybody. For those of you I have not met, my name is Caitlin Long. I am the Boards and Commissions Coordinator for BHA. And I will pass it over to Andrea.
Hi, if my virtual background is not my forte, I apologize. I've been messing with that this whole time. So my name is Andrea Jones. I am our Deputy Policy Director over at BHA. Good morning.
Okay, I think, is that everyone? Okay. Next slide, please. Okay, when our ASL interpreters begin and start with us, we'll let you know as soon as we see them hop on. And then during the event, your participants' view will follow the view of a BHA panelist. The ASL interpreters will be available to you during the event if you wish to utilize this. Hover over the interpretation icon at the bottom of your screen and select American Sign Language if you wish to view this channel. You may adjust the ratio of a screen being shared and panelist videos visible by hovering your cursor to the left of the panelist until your cursor changes to a horizontal arrow. Left click and drag your cursor across the screen until you have reached your preferred view. As a reminder, closed captioning has been enabled for this event. Click on the closed captioning button at the bottom of your Zoom window to turn on subtitles. If you need to change the subtitle language, click the caret to the right of the button and translate to your chosen language. If you're a member of the public and having technical difficulties, please send a message to the Q&A. I will be answering Q&A questions until 10 o'clock, and then I do have to jump off of this meeting, and Kelly Cossey will take over from there. As a reminder, all council members are able to unmute. Please raise your hand to be acknowledged. Prior to speaking, please identify yourself. Q&A feature is open for all attendees. However, all comments and questions may not be addressed in real time. The chat feature will be open for the last 10 minutes. The council will determine how to address any public comments or questions that we do not get to today. Recording is in progress for note-taking purposes and for any council members not in attendance. All future meeting dates, agendas, and minutes will be posted to the BHAAC website. Any questions or comments regarding the council or BHA can be submitted via the Contact Us section of the BHA website. As a reminder, we have the following group agreements: listen and engage respectfully, difference of opinion are natural and useful, have an open mind, be curious and be bold. Everyone has equal voice and valuable contribution. Take space and make space. Keep to time and agenda, start and end meetings on time. Please don't use acronyms. And it is okay to turn off your camera and take time to reset at any time during the meeting. And with that, I will pass it over to Raquel.
Good morning, everyone. So good to see you guys this morning. I think we are moving forward with asking for a motion to approve the September 19th minute, or our minutes, not from September, our previous minutes, right?
Actually, Kel, if you want to go ahead and do the call to order, roll call, and then adopt.
Oh, there you go.
today's
Okay,
agenda,
I got you.
Then we'll do the meeting minutes after Kelly.
You got it. Okay, we're gonna call to order. We're gonna do roll call. Tasha, are you taking over roll call?
All right. Ash Castro. Present. Dr. Rob Archuleta.
Present.
Raquel Garcia.
Present?
Carolyn Hall.
Present.
Dr. Ron Leal.
Present.
Maria Martinez.
Here.
Jamie Ulrich.
Good morning, I'm here.
Cameron Vijo.
Present.
Catherine Washington.
Present in the
Seth.
chat.
Seth Watkins. And then wait, I don't want to chop this up. Swaylin White Skunk. Did I say that right? I hope I pronounced it.
Selwyn White Skunk.
Thank you so
Councilmember.
very much. Thank you. And Tasha Conker is
And
present.
I'm here.
Okay. Catherine Renee Anderson. Or Karen Renee Anderson, sorry. I chopped that, my bad. And I think that is all of our council members, correct?
Yeah, I believe we have Raina Shaner. Raina. All right, then yes, we are good to go.
All right.
Thank you,
Thank you.
Tasha.
Thank you, Raquel.
Thank you, thank you. Quick overview of our agenda today. We are going to start off with hearing some words from Deputy Commissioner Kelly Cossey. We'll move to a meeting approval or a motion to approve the minutes. We're going to do some BHAAC business where we'll vote in chair, vice chair. We'll go through our business and we'll take a break at about 10:15. And then we'll come back at 10:30 for a review from the BHA on the rule volumes update, and Ryan Templeton and Tom Miller will take that over. We'll go at 11:50, we'll open up for public comment, and then at noon, we will close out and adjourn. Motion on the floor to adopt the September 19th agenda as is.
So moved.
So moved. Second.
I'll second it.
Thanks, Carolyn. We'll move forward with the adoption of the September 19th agenda as is. Thank you so much for that, everyone. Now we'll go forward, and Kelly, I'm giving you the mic.
Thank you, Raquel. Good to see everyone today. I'm standing in for Commissioner Smith, who's in Grand Junction doing a community visit. And so she's much more eloquent than I am. So I'm going to do my best as her stunt double. And first, she wanted to make sure to just thank you all. In her visits, she's been getting some really good reception from folks, really good input from community. Several of you all as BHAAC members have been part of those visits. And so she just wanted to make sure that I conveyed her appreciation for your involvement and engagement, and for also inviting others from your communities to take part. So thank you very much for that. I have two things that Commissioner has asked me to share with you all today. And hold on for 1 second before we pull up the org chart, because I want to share the first thing. One is on the realignment of the org chart, and I'll get to that. But the first thing that I just wanted to share as an update is that by statute, by November 1st, the Department of Human Services is required to provide a report to the General Assembly concerning recommendations on whether BHA should remain within CDHS. So when we were created, this was part of the timeline, and the recommendation is now due. And so the recommendation on whether BHA remains in CDHS or if BHA is to be transferred to a different department. And it is the recommendation from Commissioner Smith that BHA remains at the Department of Human Services. And there were three main factors that went into that recommendation. The first was the cost of moving BHA to another state agency is not budgeted for, nor should that cost be prioritized in a tight budget year. The second is the upheaval of current processes in place between BHA and CDHS, like procurement support, things where they've provided that back office support, that might delay BHA's priorities, including but not limited to executing all these inaugural contracts with the BOSSOs. The third main factor that went into this recommendation is that it allows BHA to continue to stabilize and focus on the foundational actions needed for BHA to be Colorado's behavioral health authority. So she just wanted to share with you all that that's the recommendation. It's supported by Director Barnes, and just with the timeliness of it and the dates that all of this is due, she just wanted me to make sure you all are aware of the recommendation that she'll be making. The second thing that I've been asked to share, and some of you have already seen this, so bear with me. I'm going to do it very high level, and Caitlin or Megan, give me the high sign. I want to stay within my 20-minute allotment for all of this. So it's high level, but also happy to share more information, any of that. This has been out there. We could share it with you all as a document, so you'll get this. But if you'll put up on screen the org chart, and then we might be able to put the link in the chat. I'm not as good as that is. So I'll just share with you high level that this realignment is driven by both what we've been charged with from early on from the task force, the priorities, the pillars, all of that helped inform this. The work that the commissioner's been doing to be out in community and get input, and also knowing the direction we need to be heading over these next couple of years to implement the good work that we need to do is what's informing this realignment. So it's been very intentional, very much driven by how we were started in the input and the current input we've been getting over these last 6 months that Commissioner Smith has been here. And along with this, org chart is just one tool. Commissioner has mapped out quarter by quarter the milestones that we need to be reaching as a BHA to be able to achieve the goals that we want. All of that can be available to you all. And again, bear with me. I know some of you have been part of this and know it. So at a very high level, I'll just move from left to right. And excuse me 1 second. And then be mindful that for those of you who aren't as visual and you don't need to be concerned with the yellow dots and the orange dots. The yellow dots are the positions to be hired. The orange is just more internally of inner workings for how to make the positions work. And so from left to right, Commissioner is hiring a chief strategy officer. Within that team is where Megan's team, where she leads her team on engagement. And then there's project support, specific things that chief strategy officer will be moving. The chief medical officer that's below it isn't a FTE. Instead, it's more of a consulting group, 2 or 3 psychiatrists. One, at a minimum, one will have a child psychiatry background, but they will be psychiatrists that will help inform our work across BHA. 988 manager, that's the enterprise board. And the leader of that, the enterprise board is working on that. And that's the connection from the enterprise board to Commissioner Smith and BHA. This is where then for the deputy positions, our roles are changing. Mine more so than Aaron's, but both of us will be then leading a focus on the age spectrum. And so Aaron is focused on adults. She's had that already anyway, adult and children, but she was focused more on the adult side. So she still will have the IT team. That's where Performance Hub and all of that sits. She's leading the work we're doing to have BOSSOs and that model be implemented. And then she also has the statewide programs that are predominantly adult-based. We know there's overlap of children and adult, like care coordination. Those will still sit with her. So just to emphasize that. And then in my role, I'll skip the admin for a minute. In my role then, my role is shifting to focus solely on the children and youth continuum, and the workforce team will remain with me also. And so within that team, I'll have, and I'm hiring for this now. I've been sharing the job description. Please help me get the word out. I'll have a division director, and I'll have the children and youth focused programs of BHA. And I'll still have Matt Holtman, who's leading our children and youth plan with me, and we're building out that team. And then the workforce team that Lisa Weinberg leads for us is still with me under that. So those are the two bigger shifts around the age spectrum. And then you'll see in the middle of the org chart, we're hiring for that deputy commissioner of admin. We have a CFO position. That hasn't changed much. That's all our good finance, fiscal, contracting team. On the far right is our chief communications officer. So the comms team reports directly to commissioner. We'll have a chief people officer, that's HR. And that's where our EDI director will sit. And then also the typical kinds of HR functions that happen with that. I believe I've covered the big topical areas for that. The shifts go into place as of October 15th, and then through December 15th is when all this transition happens, getting it organized in that way. On the top level, we'll keep doing the really good work we're doing. Some people are just reporting to new folks, but as you all know with the state, there's lots of other behind the scenes stuff that need to happen to make all the logistical pieces work. And that's why it's going till December 15th to get all that in place. So October 15th, all the teams make their formal shifts. And then by December, we'll have it worked out on all the behind the scenes things. But the work continues. And there's been a lot of excitement around this. We've been sharing it, Commissioner has in community, with key community partners, with legislators, of course, the governor's office first and foremost before it went out. So just to say we've been getting positive feedback and feel like this is a really good direction to be headed to help us make sure we're going to accomplish all that we need to over the next couple of years. So with that, I'm going to pause. I'll see if there are things in the Q&A or the chat, but otherwise, I'll just pause there.
Yeah, I wanted to say applaud to the BHA for taking the time out too. Commissioner Smith sat down with your executive committee team, and actually we felt included. We were presented this first, so we were not surprised, which was very nice, right? If you've been here, this is really progress we're making as a council. And all of us asked our questions. Dr. Rob was there, Carolyn, myself, Tasha. Tasha and I actually arrived in person to meet the commissioner and go over this and review it. Very, very full 360 comparison to where we were. So I just love the progress we're making and applaud the BHA for including the council and being able to be the first to see this. So we weren't surprised in this meeting. So bravo. Does anyone else have any comments or responses?
I'll just piggyback on what you said, Raquel. It was awesome. Thank you for letting us see this up front and give feedback. We had a lot of feedback and a lot of questions, so it was good to have the answers. And like I said, super helpful to know, like Raquel said, up front and being in the loop.
Well, thank you. That's all I have. I'm here for the duration of the meeting, as Megan said, and we'll follow the Q&A and chat. So thank you all.
Thank you, Deputy Commissioner. We appreciate you, Kelly, and all the work you do, especially for youth. I'm looking for a motion on the floor to approve the July minutes. Or any discussion around those?
I make a motion that we approve the July minutes.
So
Second.
moved. Thank you, Rob. Second. The July minutes are approved and can move forward. And then we also have to approve, Caitlin, right, the August special session meetings minutes. These are a little bit different too. This is a new one for me. I'm looking for, does anyone need time to review or look at the August special session meeting minutes? And is there any discussion on the floor?
And just as a reminder, those meeting minutes for both July and August are linked in the agenda, which are in the chat.
Thanks, Caitlin. And thanks to Caitlin for getting us nice and organized and spending time with Tasha and I. It is another full 360 moment as I do this work for the second time, but getting the support I feel like we needed all along. So thank you, Caitlin, for supporting Tasha and I as we grow into these roles.
It has been my pleasure.
Thank you. Motion on the floor to approve the August minutes.
Motion to approve the August minutes.
So moved. Thank you. Looking for second.
Second.
Thank you, Rob. Look how well we're efficient as a team, y'all. August special session meeting minutes have been approved. And then this is where you're taking over, Caitlin.
Thank you so much, everybody. So as we spoke about in our special sessions meeting in August, based on the nominations that you moved forward with the nomination form, we are going to hold our formal vote for chair and vice chair, although we already kind of have an informal one running. So I was just going to go ahead and take this over and hold a vote for our chair and vice chair. So if all of the voting members can either raise your virtual hand or come off mute and say aye, or type in the chat, that would be great. So for your council chair, we have nominated Raquel Garcia. So at this time, if you can come off chat or raise your hand, your virtual hand. I'm seeing some yeses. Wonderful. Tasha, thank you. All right. Sullivan, thank you. Perfect. All right. Seeing some in the chat. All right, everybody. Thank you, Catherine. All right. So at this time, I'm happy to announce that we have a formal BHAAC chair, which is Raquel Garcia. So congratulations, Raquel. All right. Now we are going to be moving on to our vice chair nomination, which is our very own Tasha Kankar. So at this time, if members can either come off mute, raise your virtual hand, type in the chat. Seeing all the hands pop up again. Wonderful. Great. Awesome. Give it a couple more minutes. See some more hands. Great. Tasha, yes. All right, everybody. And at this time, we now have our official vice chair, Tasha Kankar. Congratulations, Tasha.
Thank you, guys.
All right. Oh, and I just realized that I am jumping the gun for the 35. So my apologies, that is obviously a typo. So 2025 meeting cadence is what I was actually trying to say there. You know what? It feels like a Monday on a Thursday, that's for sure. So for 2025 meeting cadence, I am happy to announce that we have spoken with the commissioner after speaking with you all and really hearing, the needs of this council and the needs of, more continuous updated conversations. So we are happy to announce that beginning in January of 2025, we are going to be moving to a monthly meeting base. So we will still be meeting the third Thursday of every month. However, it is going to be from 9 o'clock in the morning until 10:30. So it's only going to be a 90-minute meeting. So we don't have the 3-hour meeting anymore, but we will be moving it to that monthly format. So we're going to have, just the same amount of time together, but just more frequent conversations and updates and check-ins. So just wanted to bring that to the table and see if anybody has any comments, questions, concerns about that right now. Just wanted to open up to the floor for all the members.
Again, I just want to say thanks for listening to council. It took us almost a year and a half to get someone to listen that we could not swallow life from a fire hose in 3-hour segments every other month. And it feels like this is something that feels more doable and tangible and obtainable for us. So I appreciate the BHA listening to council.
Thank you for that, Raquel. And yes, Cameron, I see in the chat for opportunities for in-person. So we are wanting to do some hybrid meetings with you all. So our goal is, kind of why as we reintroduce ourselves back into the in-person world, as well as, we restructured these meetings to move to that 90-minute monthly format. We were thinking to host a virtual hybrid option quarterly. And so what we're kind of thinking about is going to each region within our regional divisions to host a meeting every quarter. So that way different members from the different regions, we can all meet together. We can go to your neck of the woods and really start, seeing your communities and where you come from and the people that you represent. So that is something that we are going to be proposing, as we transition to this new format. It will still be a hybrid option. So that does not mean that, if we go to Grand Junction, everybody's expected in Grand Junction one day, for those of you that would like to attend in person, obviously you're more than welcome, but we will still be holding that hybrid space. So we will still have this virtual option for members who it might not be convenient for at that time. Any other comments, questions, concerns? Seeing some good thumbs up. That's a good sign. All right.
Jamie's got a comment.
Oh, sorry, Jamie.
I do. That's okay. Do we have the new calendar updates yet sent out for the new meeting cadence?
No. So
Okay.
we only have until November, which will be our last meeting for this the year of 2024. And then following that, I'll be sending out the new meeting cadence moving forward for next year. So you'll be getting that Zoom invite probably after the November meeting, just to make sure that we don't cross Zoom invites and you get for showing up on wrong links or anything like that.
Yeah.
I've done that several times myself. So
Well, I know for Jamie too, it might be for me too, the sooner might be better on the hold on the calendar. So I'm hearing you, Jamie.
Yes.
It would probably be easiest for those of
Yeah.
us that have to do others if we can get our calendars locked down sooner, even if it doesn't have like a link to the Zoom, it might be easier for Jamie and I know for myself to at least get that blocked out so we can build our next year's calendar a little bit around it. I know for probably Dr. Ron Lee as well, and Dr. Archuleta, it might be a lot easier for some of us to get that booked in.
absolutely.
You read my mind.
That calendar invite hold. Again, we'll update it with the Zoom information and all the good stuff a little bit closer to November, but I will get that meeting calendar invite at least sent out so you can start seeing it on your calendars. That was a great recommendation. Thank you all. All right. So moving on, talking about our applicant recommendations to the commissioner. So as it has been linked in the chat, we have a couple of wonderful people that we are wanting to move forward with appointing to be formal council members. So the email that I sent, I believe it was last week, with the agenda has that link for the applicant information that we're going to be moving forward with. And I had asked you all to review that ahead of time. We just wanted to take a moment and see if there's any comments, questions, or concerns about who we have asked to move forward with. And then I will pass it back over to Raquel to hold that motion to move those applicants forward. As a reminder, we, as the advisory body, have that advisory capacity. So we're advising our recommendations and sending that over to the commissioner. But the commissioner does have the ultimate stamp of approval for that. I think that she will be very pleased with the applicants that we have moved forward with. They're all extremely strong and knowledgeable and have a wealth of both personal and professional experience that would be wonderful to bring to this council, and so many unique different viewpoints. And so I don't anticipate her saying no to anybody, but just wanted to let everybody know kind of, next steps will be once we make this motion, we'll move the applicant package forward to the commissioner. She'll review and sign, and then we will be working with your newly appointed chair and vice chair to start onboarding process with these new members. That's going to include some training slide decks, the letter of commitment, code of conduct, and just some general information about the council as a whole. So that's kind of our next steps for everything moving forward. So I will pass it back over to Raquel to make that motion, as long as you all don't have any comments, questions, or concerns for me right now.
Dr. Archuleta?
Yeah, I do. Sorry. Let me figure out how to put my hand back down. Sorry. So I just want to make sure I'm hearing this right, because I missed the email. So the people that we're moving forward with that you're saying they haven't received the code of conduct or expectations yet, and we're going to move forward with that. So I'm confused why that wasn't done up front right off the bat, so that they know what they're getting into, because I think I speak for everyone when I know we would have loved to known all of those things before we were even brought into a formal meeting to discuss. Do you know what I mean? Like, so it sounds like it's a little backwards still, like not everything was done up front, because it sounds like we're moving forward, we're discussing them, but they don't have all the information. They don't have the code of conduct yet. They don't have all of those things. So I guess I just want to, am I the only one that feels that way, or does that make sense?
It definitely makes sense. So I actually have reached out to each of the members individually that we are looking to move forward. First of all, to gauge their interest in participating as a member of the council, because there was a little bit of time there in between, applications and interviews and things of that. I have met with multiple of them one-on-one just to kind of review what the council is, the purpose of the council, the function of the council. I've also sent them links to previous agendas and meeting minutes, slide decks, and things like that. So they are aware of a lot of that information. The formal code of conduct, they had not been sent yet, but we can absolutely send that information ahead of time as well before we do any sort of formal approval.
We had also discussed current council members being a part of that process to give them a heads up on what it would be and how that's going. Was anybody a part of that?
Yes.
No,
Okay.
well, people were
There was?
interviews.
Okay.
Yes. Yeah, absolutely.
good.
Dr. Rob. And
Yeah.
I think what we had talked about, Tasha and I, we do know that we would have liked those. And so those are some of the things we'd like to create moving forward as a council, is what are the things we thought we needed to know or would have been great. And so we didn't want to make those without everyone having some input in that. So that is part of what we want to do in the next chapter of this council, is make sure that we set up the next council, whatever that looks like, for success, by making sure that those things are also created by us a little bit, right? Versus them, the state telling us what we think we're going to do, because it didn't really work out that way. So we're going to have some input on what that looks like in the future. So we'll be definitely asking the council for their opinions and their suggestions.
Yeah, it already sounds like an improvement if there was interviews done, right? Not just an email with the paragraph. So I think we're already on the right page. Do you know what I mean? We're going in the right direction. I just thought I'd bring that up.
Absolutely. No, I'm glad you did. Because you're right. It would have been, sometimes it's pulling the cart before the horse, but we'll get it right. And yeah, Tasha was in those interviews. I had done some interviews. So Tasha?
I was just wondering, Caitlin, what email date that was with the nominations?
It was last Thursday, and it had the agenda link there. And then I asked for you all to pay special notice just to that link that has the applicant recommendations moving forward. So it was sent
thank
out
you.
last Thursday with the agenda. Absolutely. Anything else before I send it back over to Raquel for that motion?
Yep. Okay, seeing no further discussion, looking for a motion on the floor to approve the recommendations to send over to the commissioner for review.
I'll move to approve the recommendations being sent over for review.
So moved. Thank you, Jamie. Looking for second.
I second that. Sorry.
Maria, Tasha, thank you for the second. The recommendations that the council has suggested will move forward to commissioner for review. Thanks everybody for your participation.
Thank you all. All right.
Really quick, could I just ask one other thing? So, and then also if they do decide that you send the code of conduct or whatever and they reject it, will you let us know that as well?
Absolutely.
Okay.
Absolutely. Yes. And then what we can do is we can all hold, an ad hoc recruitment period to get specific, if we need specific seats filled, statutorily or anything like that. We can address that as well in the future. But everybody that I have been speaking with seems really excited and really enthusiastic about participating as a member of the council. So hopefully we won't run into that, but if we do, we will absolutely address it, let you all know, and then come up with the next plan of action. All right. So I just wanted to quickly let you all know about some bylaw office hours that I'm going to be holding for the council. So it will be every other Wednesday at 9:30 a.m. beginning on October 2nd. I'm going to be sending you all out a Zoom invite for that. This is not mandatory for the council members to participate in, but I just wanted to hold some extra space for you all. I know you get a lot of forms and things like that, and so wanted to have another option for you all to be able to come and discuss bylaws as we work through, really tailoring them to the specific needs of this council. And so what we were planning on doing is just holding, an hour every other Wednesday for those members who have the availability and bandwidth to come and participate as we walk through these bylaws and start incorporating some of your feedback and answer some of your questions and things like that. And then we'll tie that in with the feedback that we've received from the form. And so hopefully by November, we'll have the second draft of bylaws that will have, your first initial comments and questions and concerns answered. And then we'll review that and keep moving forward from there. And we can do, third draft, fourth draft, fifth draft as we need until everybody is on the same page and feels comfortable with enacting these bylaws. Any questions about that? Again, I have not sent the Zoom link out. I don't want you to jump the gun and you guys be like, what are these links for and things? So I just wanted to let you all know that those office hours will be held again beginning on October 2nd at 9:30 a.m. to 10:30 a.m. and you'll be receiving those Zoom invites after this meeting. And again, not mandatory. It's just for members who would like to participate and have the bandwidth to do so. Tasha?
I was looking over that document and I was just wondering if the compensation was changed in there because I didn't see that it was. And I've been getting invoices to sign, so I'm a little confuzzled about that. So
yes, so compensation has not been added yet. There is like a little sentence that says compensation is being currently reviewed and will be subject to fiscal appropriations. We actually just received our approval from the commissioner. So we're doing a couple little more tweaks and then we're working to get that enacted November 1st. So you all will receive an email from me with that information as soon as we do get that final stamp of approval. But we're headed towards the right tracks and we're looking at that November 1st. Anybody else? All right, so just keep an eye on your email for those times, and just really encourage you to participate if you can, because these are your council bylaws and we really want them to be as unique as you all are, and have your voices shine and really have these fit the needs of this council. So any participation that we could get would be really helpful and appreciated. And then lastly on my list, we're cooking today.
We are getting it. Go ahead, Caitlin.
Is the annual report prioritization list. So this was something that I wanted to bring to the council to see if this is something that we would like to do. So as you all know, and you have voted on, we got the official 2024-2025 annual report submitted and uploaded to the BHAAC website, which is an amazing accomplishment. And thank you again for all of your participation and help with that. That was not an easy feat, but you all did it. And just really, really proud of all the work that you put into that. So based off of your recommendations, this is something that we did very similar with one of our other councils, is make a list of prioritizations based off the recommendations that you all made. So what we're going to do is, kind of break it down into category, whether it be like data and tech or program or community engagement and things like that. And we'll have each of your recommendations listed there. And then during the November meeting, wanting to set some time aside to review this information with you all and, make that prioritization list. So some of our highest priorities, medium priorities, and some of our lower priorities. Obviously, I know that we want everything to be a high priority, and eventually we will get there. But, for this next year, really wanting to set some goals and get our, kind of a year's agenda built out so we can have the correct people come to speak with us, be really intentional with our conversations and the information that we're asking for and being presented. So just wanted to throw that all out there to you all and see if this was an agreeable idea, if there is another format that you would like to discuss instead of a prioritization list, and really just put it out there for you all to think about and discuss.
Personally, I like the priority list. I mean, it makes it easier for us to focus and also see if we've achieved something. So it'll be something different for us and narrow the scope a little bit for us on what we're trying to achieve. Tasha?
I was gonna say, I like the priority list for the simple fact that it keeps us up to date on what's going on with statute, and that we remain in compliance with statute as the advisory council. So there's no chance of falter for anything. So that's where I am complete transparency and accountability all the way around. So.
Any other discussion on the floor?
Right. Well, I will start to get to work on that then, and then we can take some time during the November meeting and review this so we can start building out that, executive annual calendar for the year. And again, just be really intentional with our conversations and who we're having to come speak with us, and the request for information that we're asking. So. All right, everybody. Well, thank you so much for that. And I will go ahead and pass it back over to you, Raquel.
Yeah, looks like we're early for a break. Do you want to go ahead and take that break now? And then maybe we'll get out of here early today, maybe, right? We don't have to stay. We don't have to stay full time. We can get out 10 minutes early. I'll give you guys 15 minutes. We'll return back at 5 after.
10:05 sounds good.
Yeah.
I'm gonna go ahead and make sure that Ryan and them are because I think they're up in Winter Park today. So I'll just make
If
sure that they're
if
ready.
we want to take a little longer break, you just let me know, Caitlin, text me.
I'll message everybody in the chat. So just keep an eye out on your chat, but we'll go ahead and plan to come back at 10:05. But just keep an eye on your chat, and we might have a little bit longer of a break today, if that's okay.
We could just give it. Why don't we just give 5 extra minutes?
Yeah,
Yeah,
We can
let's
do
just do it. I'm chair. I get to say that. So we're gonna go ahead and give 10 minutes. Jamie, look at Jamie smiling. That's right. I'm the chair. I'm gonna issue us a 20-minute break instead of 15. So I say we come back at 10 after.
Sounds
And I
good.
second that.
Thank you
See you guys
all.
at 10
Thank
after.
you.
I
See you
won't
at
see
10
you after
after.
the break, but I will see you next time.
Thank you,
See you,
Megan.
Megan.
Caitlin, did you see my emails?
I did, Dr. Rob. I re-forwarded you those emails. I've also talked to you in the chat here.
Oh, you did? Okay.
Yes.
I just didn't, I don't know why I'm not getting it. Now I'm like, what the heck? Do you know
Are
what
you
I,
able to link? Are you able to click on the agenda?
yeah, the agenda, but there's no names, no nothing on it.
So
It's,
if you go into the agenda, it says applicant recommendations.
and then does it say their names?
No, so you click on that link and then it takes you to that table.
Oh, okay, here it is. Is this a new appointment? This, you know, and I'm gonna tell you, is this a Google form?
I think this is a Google Doc. Yes.
So I use everything Apple and Mac.
Okay.
So somebody else sent me some grant information. You know, on my personal stuff at work, I have PC, so I'm looking at it now and I see it's all there.
Okay. I
But
can also start doing a PDF format as well, if that would be
yeah,
easier
it
for
doesn't
you.
matter. I mean, I'm not getting, I just can't, maybe I'm not getting the full information because I'm running my, you know, Safari and my Mac. I don't know like what the deal is. This isn't the first time this has happened. So that's
Okay.
once I started getting in my head about it, I was like, I want to find out what I'm missing. So I obviously, this is not in my email. That agenda brings up like a little sheet, but that's it. So
Okay.
where it says click the agenda and the agenda is hyperlinked. If
Yes.
I that it didn't open this.
So when you click on the agenda and if you go into the agenda, there should be another hyperlink under the BHAAC business section that says applicant recommendations to commissioner.
I'm curious now. Now I'm gonna look. You sent it again. I'm gonna go
Yes.
click agenda. So then it brings up, oh, these are all hyperlinks.
Yes. So now I see you in the agenda. And so
And then
yes, there's the hyperlink
applicant
to the
recommend.
meeting minutes and then the applicant recommendation. Yes.
Can't click it.
So it's not letting you click it?
Hmm.
Okay, yeah, it says that you have viewing capabilities, but what I can do next time is I'll just put everything into a PDF format,
But
and
well,
see if that helps.
you don't have to. I just highlighted it and opened it in new window and it opened.
Okay, perfect.
So now that I know that, I just will do that. Yeah.
Okay,
I just I was trying to click in, it wasn't working.
no worries. My apologies for that.
No, it's good. I'm glad that we talked. That way I can like
Technology can
maybe
be
that's
great
how
when
I
it
gotta
works,
go.
you know?
Yeah. I think I need to do this on the other stuff too that I was sent from this other lady. Dang it. I guess I just took it at face value that it wasn't working. All right. Sorry, I don't want to ruin your break. I'll log off.
No worries. I'll be right back as well. I'm just gonna go get some more water.
I love how Dr. Ron Liao's camera froze on the smiley face, or is it just me? It cracks me up. I've never seen that happen. Hope you all enjoyed your little extra break.
Yeah. Got a
It's
fresh
interesting. I have to
coffee.
remind myself often of like that I could extend that 5 extra minutes if we want to. We're still within our time frame. Thanks, Dr. Lee. Dr. Liao, I see your comment in the chat. Welcome back. I am going to have to step away for an emergency for the rest of this. I have to go do an intervention. I'm still the person who still does services, so I've got to step away. But Tasha is going to take over for the rest of the meeting. I have to go help a client and a team member. So I appreciate y'all giving me grace. As Tasha steps in, we're gonna start in with Ryan, right? Ryan starting off. All right, Tasha, you got this. You can't mess it up. It's the place of grace.
Yes,
I appreciate all
Yep.
of you. I'm gonna go help somebody out.
Thank you
See-
for your service, Raquel, and all you do for the community.
thanks, Raquel. Ryan and Tom are both joining us any moment. So if you can give us about 2 more minutes for a very extended break, and then they should be hopping on. If not, we'll be able to pull up some materials and I'll get us going. But
All right.
I think they are on standby and just about here. So bear with us for 2 more minutes. Thank you so much.
Thank you for the communication. Appreciate it.
Yeah.
Welcome, Ryan. Welcome.
Hi, Ryan, how are you?
Good morning, BHAAC.
Good morning. All
Tom and I
right.
are both in this tiny little conference room here.
Oh, is that the
You
echo?
are
Okay,
echoing.
so Tom is on as well. So are we
All right.
on the break now, I'm assuming?
We're coming back from break. You guys are here so we can all move on with agenda with BHAAC business. And I'm going to introduce Ryan and Tom. They're going to be presenting on the BHA's 3 rule volumes update, and take it away.
Ryan, I made you co-host if you want to share the slide deck, or I'm happy to as well.
If you could do it, that would be fantastic,
Sure.
Keelan.
Not a problem.
Hey, what's up? Good. I'm in this BHA meeting. What's going on?
I'm gonna call Rob just so he can say, yeah, what's up?
Sorry.
It's all good.
Not a
It's
You
all-
problem.
don't need to be sorry. It's great. Thanks for the laugh.
Everybody hear me okay?
Yes. Welcome, Tom.
All right, sorry, we just hopped on, so I'm going quick to get everything working. What I hope to do today is do a brief overview of the several rule volumes that we have going, two new and two that we are, and excuse me, one that we are amending, the provider rules. But first, let me start with an introduction for those of you that I have not met. Tom Miller, he, him, his pronouns. I am the division director for the Quality and Standards Division at BHA. It's nice to see all of you again. Let's see, do I have control of the slides, or is that something that I just had Caitlin pull it up? Okay.
Yeah, so you just let me know when you're ready to move to the next slide.
Lovely. Let's move to the next slide. Thank you very much. So here's our quick agenda and what I hope that we can get through in our, albeit pretty short time today. We're going to talk about the rules and the three separate rule volumes, some of the rule promulgation timeline. So when we do our community engagement work and when we present to Commissioner Smith and or the State Board of Human Services, and when those rough timelines will be, and then specifics about the provider system and administrative rules. So next slide. As you all know, it is our vision to make behavioral health services in Colorado accessible, meaningful, and trusted, and that we are working together, co-creating a people-first behavioral health system. BHAAC is an essential part of that, and we, as BHA staff, have very much appreciated our partnership in that regard. Next slide. So what I wanted to start with BHAAC and what I'm doing in each of our virtual and in-person rule meetings is going over a little bit about what a rule is. So in a very basic way, when legislation is proposed and passed, it frequently requires the State Department named in that legislation to do what's called promulgate rules. That's just a fancy way of saying write the rule, which we do at BHA in conformity with the law. And our rails are the rule can neither do less than the law requires, nor can the rule do more than requires. But in particular, it must clarify what the intent of the law is. The second thing that is critical when a law requires a State Department to promulgate rule is for that State Department to go out and ask people in the community, in particular people with lived experience that are going to be directly affected by that rule. What do they think of what we've drafted? How should we change it? What's working? What's not working? So we do a number of those, and I'll talk about that in just a minute. And we take that feedback, we make changes to the rule, and we also go to the State Board of Human Services, or in the case that's coming up soon, to Commissioner Smith and say, here's all the feedback that we got and why we think that this is a good rule. Next slide. These are the three specific rule volumes that I was alluding to. The first, which is the provider rule, which I think folks in BHAAC are familiar with. What we're talking about here are the rules that set the licensing, designation, and approval requirements for those agencies out there that you've probably heard me talk a lot about over the last couple of years. And in this particular case, we're talking about what changes we want to make in those particular rules. And again, based a lot on what that provider feedback has been. The other two, system and administrative, are our new rule volumes. System rules are what describes the BHA the BHA's vision for the behavioral health system, and administrative rules that will control how programs and initiatives are accessed. Two quick notes. These rule volumes themselves, which you see listed at the top of the slide, 2 CCR 5021, and then -5 and that -6, these rule volumes already exist. So we're going to populate those with system and administrative rules. So Ryan's going to talk about both those system and administrative later in the presentation. Next slide.
Tom, I did want to just point out in the chat really fast that Tasha had a question about this, just confirming that it's like a set of guidelines for law, correct?
I very much appreciate the question. And also, because of the way I have my screen configured right now, I'm not seeing chat. So if we do get additional questions as we go through, I would love for you to call that out for me if you don't mind. So thank you. First, thank you for the question. Yes, I would say that when a law is passed and it says to a state department, in this case, Behavioral Health Administration, you have to promulgate rules, we write the rule. Now, the perhaps splitting hairs here is that the rule is actually more specific and more controlling than a guideline. A rule is something that a licensee has to follow. And when we issue a license to an agency and it becomes a licensee, then I got a pop-up on my screen, and for a second there I couldn't see anything. That licensee has due process rights, meaning if we're going to take an adverse action against that particular facility, we have to provide notice, and they have an opportunity for hearing with a Colorado administrative court. So that's a formal way that rules operate. I did actually see a chat pop up about transparency. Ryan and I were actually having that specific conversation in the car on the way up to Fraser today, which is where we are. And that's a wonderful thing about rule, is that it is very transparent and much more transparent than a policy or a guideline or a memo, because we draft the rule, we put it out there for people to see it, to give us feedback on it, and then we go out in a semi-formal way and say, tell us what you think. I believe that is extremely transparent in a very egalitarian way for state departments that have this authority and responsibility to communicate with Colorado citizens. I love that about the rulemaking process. Appreciate the question. Next slide, if I may. This is the rule feedback opportunity that I was alluding to a little bit earlier. You can see in the first part of this, the in-person schedule that we've set to share all these rules with Colorado communities. Grand County, that's where we are today. And then next week, Montrose, and then Aurora, Colorado Springs, and Greeley. And we also have the 4 virtual meetings, the first of which was yesterday. I think that went really well. Sometimes the first one's rocky, but I think we knocked it out of the park. We also have there in the last part of that slide, the 2 places on the website where folks can give us written feedback or testimony. All of the feedback we get, we keep very careful track of. We turn that into the commissioner and the state board and say, here are our efforts to get feedback and what we've done to incorporate the rule. We respond to every single bit of feedback we get. And what I frequently say and very much believe is that as a result of that feedback, we make a better rule volume. Next slide. So getting into some of the specifics about the provider rule, again, not system and not administrative, but provider. So the part of the rules that deal specifically with licensed, approved, and designated agencies. Here are the things we're changing. We're doing some tweaks with a behavioral health entity license. That's our largest license category. Think of it as an umbrella license that we plug in and out endorsements for specific service categories. We're making some changes in that. Safety net approval, that's our brand new category. Based on the legislation, we wrote those rules. That's new, that changes the behavioral health system significantly. Again, making some technical cleanups and improvements and changes in that. 2765 designation, that 2765, of course, refers to a section of Colorado law that deals with facilities that can serve people on short and long-term certifications. There have been several pieces of legislation that I'll talk about briefly in just a minute that we've incorporated into our draft rule. And then our biggest section of change is controlled substance license. That's really a lot of new information that we drafted as a result of what SAMHSA, the feds, as we lovingly call them, changed as a result of the COVID pandemic. Next slide. Could you go one more? I wonder if maybe I didn't put it. Yeah, so the other one was just an introductory slide. I wanted the group to see this really just as a way to make sure that people understand how we've organized provider rules. Much different than system and administrative rules, which are 10 and 12 pages perhaps a piece. So
9 and 3, Tom.
9 and 3 pages a piece. We're talking more like 300 pages for provider rules, because those rules do every single one of the things you see in these chapters. Now, we're not going to go through all of that today, nor are we going through all of that with the changes that we're rolling out to the community. Again, we're focusing on what I did in the previous slide. A little bit of safety net, a little bit of behavioral health entity, 2765, and then the big part, controlled substance licensing. Other thing to note here is that controlled substance licensing will be a new chapter in this rule set. And then chapter 14, recovery support services organizations, existed in our old rule volume. We're picking that up and moving that to this new rule volume as chapter 14. There aren't any changes in that license type called RSSO. I think I should pause here and say, before I jump into the specifics for controlled substance licensing, to see if there are any questions thus far. I see that Ryan put into the chat the BHA laws and rules website. I very much appreciate that. That's a great place to go to see these rules. So if you want to look at them in total and see lots of helpful orientation information about ways to understand what the rules mean, to see whether an organization qualifies as one of these licensed, approved, or designated types, that's a great resource page that we've developed at BHA.
Carolyn has it.
Carolyn, thank you for raising your hand.
Carolyn, you're muted.
So I have two questions. How often are the rules changed, and what determines for the rule to be changed?
I love that question. Thank you so much for asking it. I will say I'm embarrassed to admit that that's one of the ways that OBH fell down on the job a little bit. And that's part of what we have improved and want to continue to improve at the Behavioral Health Administration. So the first thing in response to your excellent question is, we drafted the rule last year. We presented it to the board. It was approved and made effective January 1st. And we are back out already with the feedback that we've gotten over the spring and summer, and already responding to that feedback, and I believe improving the rules as a result. So what we have frequently said about these rules is we do not write them, get them passed, and then put them on a shelf any longer. Our process of soliciting feedback and changing the rule as a result of that is continuous now. So practically that means we may be back in front of state board or the commissioner twice yearly, perhaps, in terms of saying, hey, we have a number of community folks saying we need to change this particular rule. So that's why we are back in front of you to propose this. Now, in terms of what it takes to reach what I would call a bright line for change, I think if we get enough people saying a certain thing, or we recognize that there's been a technical problem with the rule, we'll go ahead and do it at that point. I hope that answers. Were there other questions along those lines?
There is a question about where chapter 13 is located.
If you go to the laws and rules page and click on the link for the Secretary of State website,
I'll include the updates as well.
Okay, lovely. So maybe that wasn't a question about where to find them on the Secretary of State website. It's just where to see it on our laws and rules page. I want to make sure I got the question correct.
I can elaborate on that. I'm on the code. This is Tasha Conker here. I'm on the Code of Colorado Regulations for the rules. And I don't see chapter 13 on here. It only goes to chapter 12. So
thank you so much for asking the question. I realize what I said earlier is maybe a little misleading. That is not included as chapter 13 or 14 for that matter yet, because what we're doing is that we're proposing that we create those two chapters and add them to this section of rule. But if you go to the Secretary of State website and look at that and scroll all the way down below chapters 1 through 12, then you'll see what we refer to as our old or legacy rule volume that starts at chapter 21. That's where you'll see RSSO and CSL now. Really appreciate that question. Yeah, that's a complicated part about our rules, because we have a section of new rules and we have a section of old rules. And part of what we're cleaning up this time around is to incorporate those old ones into the new ones, and then get rid of chapter 21, etc. Those old rules really once and for all. So it's been a year-long process of having overlapping rules. And then very quickly, the reason for that is if we issued a license in those old rules, that licensee, as a result of having due process rights that I mentioned earlier, gets to keep that license for a year. Thus, we have to keep those old rules until all those licensees have run their license term. So that's really the technical legal answer for that. Thank you very much for the question. It lets me make that bit of clarification. I think we're ready to move on to the next slide. All right, next one also. So really, what does it mean to do a technical cleanup of the rules? As I alluded to a little bit earlier, we're talking a little bit about citation and grammatical errors. As many eyes that were on this rule to begin with when we did it last year, we still had some of those. So we're making some of those minor changes. More importantly, we are clarifying some rule sections that had ambiguity in them, and even just adding a few words cleans that up. We have worked really hard to reduce any inconsistency. So if a part of our rule conflicted with another part of our rule, or probably more likely, a part of our rule conflicted with another state department's rule, we're attempting to clean those things up. And then in addition to that, we've also worked very hard to reduce administrative burden. Now, that's administrative burden for those licensed facilities, but also for us always. And I want everyone to hear this. This is very important. We only do that when we don't believe it will affect the health, safety, welfare of the people that are being served. And then finally, I think as I've alluded to, we're talking about changes that reflect those interim legislative updates. All right, next slide. So here's when we get into the specifics of what some of those regulatory additions are. We're talking about changes to the definition of owner. Now that's important because we determine who we have to do background checks for if we get an application for an agency to be licensed. And we've used the definition that exists with the Colorado Department of Public Health and Environment. So that's consistent across state governments. With Chapter 2, we've allowed endorsements to be added and subtracted to the behavioral health entity license itself. The reason this is important and the reason that we created an umbrella type license to begin with is that if one part of a service in an organization is not going well, we can remove the ability of that organization to provide that service and not close the entire organization down. So legally and practically, that's a great advantage that we have to assist an organization to improve without shutting it down. The next is in Chapter 8. We've clarified that FBI background checks are required for all employees, not just new employees that are joining the organization. The obvious issue being sometimes bad actors are already working at an organization and we want to be able to determine that they're fit to provide these services. Moving on to Chapter 11, we have changed our rule to allow facilities that are licensed by the Colorado Department of Public Health and Environment and their different seclusion room dimensions to qualify for our regulatory requirements. This is a great example of an administrative burden that was very difficult for providers because our seclusion room dimensions were larger than CDPHE's, and it meant that these facilities, to get our designation, had to do construction. So we've ended that. We don't think that that's a harm to people receiving services and an advantage in terms of administrative burden. The next in Chapter 11 is adding in draft requirements for minors who may benefit from electroconvulsive therapy. That was a House bill that passed just recently, so we've updated our rules to reflect that. Same with 11.10, age of consent for mental health services. We've updated our rules to reflect the requirements of that legislation. The next at Chapter 12 aligns timelines for facilities that may have two kinds of licenses or a license and a designation, that we can shorten one cycle to align with another cycle so that a facility has to prepare for our audits and just do it once. Again, another great example of reducing administrative burden. Is there a question? I missed it while it was.
Yep. Is there any changes to the waivers or how will waivers affect the new rules?
We are talking about regulatory waivers and that waiver process. And
yes, see some head nods there.
We actually didn't propose or anticipate any changes with the regulatory waiver process. So that section of our provider rules remains intact, which means that a facility in question can apply through an online form that we have to ask for a regulatory change. We have a waiver committee that meets and reviews all of those. Here are the really quick things that it reviews. One, is that regulation a duplicate of statute? And if it is, we can't waive it because we can't waive law. Assuming that it's not, then we determine if waiving that particular rule would affect the person's health, safety, welfare. And if it does, we won't waive it then either. Other than that, I think, are pretty understanding in terms of regulatory waivers and attempt to grant those, though with the shortest time period possible, whenever we can. Hope that answered that question. If so, I think we can move on to the next slide. I think there's a couple more additions. Oh, right into deletions. I guess I covered them all. These are things that we're taking out of rule. So one of the legacy rules and one of the things that caused concern for licensed facilities was what we referred to as the 25% ratio for personnel. That basically spoke to the number of licensed and unlicensed staff that an organization could have. We've removed that, and we're saying, one, it's up to the discretion of the facility in question to determine how many licensed and unlicensed staff they have. And also, and this is probably the more important part, that also speaks to the individual licensure that the clinician in question has with DORA. So we're saying we're not going to double regulate that. We're going to remove that from our rules. So again, we propose that. The next here at chapter 12 is we're removing crisis services unit and acute treatment unit from the requirements of comprehensive crisis service providers. This is really a billing issue that aligns with HCPF, not that they don't have to provide that service, rather that they have to also apply to be an essential safety net provider. It's an arrangement for billing. And then finally, one of our big categories that reduces administrative burden is removing the requirement for a certificate of compliance when an agency applies to be a safety net approved agency. The certificate of compliance speaks to what the Division of Fire Prevention and Control, this is another division and another state department, does to do fire inspections. And for a facility to open, we say you have to show us that you've gotten this certificate of compliance. And then that is one of the things that we'll need before we issue a license. And we're pulling that out of safety net. There's a big asterisk here, and that is you will a facility will still need to get the COC if they are applying to be a behavioral health entity. So again, yes, I think I lost the slides there for a second. Again, the COC requirement is going to attach to the behavioral entity license rather than the safety net approval. So hope that's clear. There may be one more slide in terms of, if we go to the next one. There we go. Here's some things that we've changed. So not additions, not deletions, but just some changed language that we are proposing. It is common that a licensed facility may contract out for a certain kind of service that facility provides. We have changed the rule to say that those contracted personnel, if the agency wants, will only be required to do health, safety, welfare training rather than all of the other kinds of trainings that we require for regular employees. We'll leave that to the discretion of the facility. And then finally, back in chapter 2, clarify that discharge summaries are required for all individuals. There was some ambiguity in that particular rule, and so we're saying we believe it's critical for continuity of services and best practices for discharge summaries to be done for everyone. I think that's it for that section of rule. If we want to go to the next slide, assuming that we don't have any, well, actually, maybe take a moment for questions before I move on. Not seeing any. I would also do
the group about your pace. We're good. Going along.
How do folks think I'm doing? I recognize that I'm using a lot of time and I'm probably just on the cusp of going too fast. I think people think I'm doing okay in terms of speed.
Yeah, some head nods and
All right.
thumb raises, so that's good.
All right.
Can I just make a comment?
Yes,
I
please.
always appreciate how clear and paced you are when going through some really complicated information and changes. So I'm on the link. Ryan, thank you for joining the link. And we've been in lots of conversations as a provider about the impact of these rules on providers, on patients, on clients and systems, and they're really impactful. And so I think for the sake of the Behavioral Health Advisory Council, though, like one of the things I'm always listening for is what input or feedback do you need from us? How would our perspective collectively help inform this process as it's moving? Because it's going to move quickly, all of these things. And I'll be honest, it's a lot. So even with your calm, paced thoughtfulness, and I think you're just as clear as could be. What do you need from us? Where are we in the process? How can we help inform? I think for every topic, we want to know that, right? So we can listen with a certain ear. So if that's all right, I just would ask that. Like, what do you need from the BHAAC members? Where are you in the process? What's next? How can we help inform any key decision points, or if it's just to know and for awareness, that'd be good to know as well.
Thank you, Doctor. I think that may be the most important question. And what I believe, and would certainly ask my colleagues to weigh in on this, that BHAAC can do is say to us, you're on the right track or you're not on the right track, whether it's about a very specific rule, like, look, you should not let that particular rule be optional for a provider because here is our experience and we think that's critical. If you believe something like that may be the case, you tell us. And that is critical feedback for us to get from this very valuable advisory committee. We need you to advise us and let us know if we're on the right track or not. So in terms of the feedback, you can respond to me directly. You can fill out one of these forms. Based on what we're telling you here, you can come to one or all of the other engagement opportunities that we've scheduled to hear more, because I go into way more depth in those than I am today. You're getting the brief version, and I know it's not all that brief. To do all of that. And then if that's still not enough, I would say, please have me back. And in particular, please have some of the subject matter experts that are in my division back who understand these things even better than I do. If you really want to get into the specific details of these rules so you can understand them, and then again, you can help advise us if we are doing the right thing. Additional questions?
Looks like we have one from Selwyn White Skunk. If you want to come off mute.
Yes, good morning, everyone. My name is Selwyn White Skunk, and I am the vice chairman of the Ute Mountain Ute Tribe. I've been with this Behavioral Health Advisory Council going on 3 years. And as I see the many changes that have taken place and the new policies that have been passed and legislations to address the issues within the state of Colorado, you know, hearing this presentation, the tribe, particularly the Ute Mountain Ute tribe, I can't speak for the Southern Ute Indian tribe, but Dr. Orbely could pretty much relate to that when she comes on, or if someone from the Southern Ute tribe. My question is, how does this impact the tribe's behavioral health program in conjunction with the relationship that we have with CDHS in putting our behavioral health program, all the requirements that have been reviewed or have been discussed in this presentation? What impacts and what's the difference how in the tribe's way of providing this service to its members and to non-tribal and non-Indians in our community? Is there going to be a separate requirement, or does the tribe fall under the state rules?
Thank you very much for that question. Catherine, did you want to weigh in first, however? Okay, I'm interpreting that as no, but please do interrupt me if there's any other additional information that any other member wanted to add. Thank you very much for the question. It's a pleasure to see you again, by the way, also. The very brief answer is that if any organization, or in this case, the sovereign nation as a tribe, provides a service that meets the definition that exists in statute, that we have also enumerated in rule, then that organization, the tribe in this case, will need to seek and obtain a license to provide that service. Now, we recognize that doing business with a sovereign nation is different than doing business with a registered organization with a Secretary of State. So we try to operate with that sensitivity and use our tribal liaison to make sure that we're being sensitive culturally, that we would consider any regulatory waivers necessary to make that happen, and that we approach this relationship with how can we partner together and provide technical assistance to make sure that you're appropriately licensed, but that operates in your benefit and for the members of your tribe's benefit. And so I'd say if you're licensed to do these kinds of services, then it's not our determination at BHA who you serve with that license. That can be tribe and non-tribe members. Let me stop there and ask, did I understand the question directly and appropriately? And if so, did that turn out to be helpful information?
Well, it is to an extent, to, in me being in the position that I'm in as a public servant elected for going on 20 years now in office. I take a position of I would like to see our programs, and working in collaboration with the state of Colorado and the Department of Health, that we understand the cultural sensitivity and the sovereign nation culture. In my opinion, as I move through these committees and these programs that are initiated by the state, because we have an ongoing relationship with the state of Colorado, more in depth in the last 3 years than I ever have experienced, which is good. But I, as an individual council member for the Ute Mountain Ute Tribe, would like to take this out of the box and be in compliance and be at a level where the host state and its agencies and its partners have the same requirements, have the same opportunities as the state has, regardless of our position as a sovereign nation. And I'm saying this because I just see the tribes, both Southern Utes and Ute Mountain, but I can't really elaborate on the Southern Ute. But for the Ute Mountain Ute tribe, we kind of take, in a sense, a role of, well, you're a sovereign nation and you can come up with these other sets of rules. And it really impacts our members of the tribe that so dearly need these services and these providers to assist our membership as best as possible. I want to be, and I want my tribe, and I want my behavior health program at that high level. I raised the bar of expectation for services to be rendered to our tribal members. I'm not going to put on the issue of we're different and you got to treat us this way. It needs to be given across the board that this is what is going to be the ground rules, and this is what you need to do. I understand that, as I said, I've been here for almost 20 years, will be October. But the fact of the matter is, for me to say what I'm saying is, we need the services and we need a set of rules and policy to follow in order to structure a comprehensive program that is mirrored to the state. We want to have access to the same services that our Coloradoan citizens have at any given time. And the policies and what you just went over, it seems that it would work here with the tribe. Now, I'm taking a big long shot in saying that, but the fact of the matter is, I see that in a way of how do we really render services to the tribe, and what are the parameters of the policy? Because, you hit and touched a lot of issues that we have issues with in regarding what's the compliance, what's the licensure, what's the access to these services, and this is what we're going to insert, this is what we're going to delete. We, the tribe, should be at that same level playing field to provide these services to our membership and others as well, because, behavioral health and mental health is a serious problem in our society that, it shouldn't be a separation of government. It should be, we need to provide the services to get the best outcome for our community that surrounds Southwest Colorado. And as I sit here and listen to this, I understand it. It's a point to where how much is applicable to the tribes to utilize and to be in compliance, or to be at that level playing field with the rest of the programs in the state of Colorado. Thank you. And you did answer some of the questions that I have, or the concerns for the tribe. Thank you.
I would love to respond just a little bit if I can, because I think I understand more the point you're trying to make and the important information you're sharing. First of all, I love it. I would say, outside of the very specific changes that I've gone over so far this morning, I would go back a little bit and say, what is the whole point of the Behavioral Health Administration? And in particular, what was the point of safety net as a approval type that existed in BHA law that we turned into regulation? It was to expand services in the state of Colorado. It was to combine those services with enhanced funding from healthcare policy and financing. So I think we're speaking the same language in terms of you want those opportunities to exist for tribal members, and we want to grow services in Colorado. And so to me, after you spoke, I hear you saying, how do we do more of what BHA has to offer? So I would love to have more specific conversations with you about how you get approved to be a safety net provider, how you get licensed to provide some of these more specific kinds of services, and then maybe end with thank you. I think there was a
yes, Dr. Rob, you have
Let
your
me just flag real quick. There's been a question in the Q&A part too,
Okay.
so we'll get to that also.
Okay.
Yeah, I just was gonna say, like, back to what Dr. Ron Lee said, this is like where we should be involved, right? This is where, as a council member, I'm just gonna voice this, and I don't know if I'm the only one that feels this way. But this is what happens when we're just informed in these meetings, because these meetings are supposed to be for the advisory council to advise, right? And so I feel like this should be another meeting where we're advised on all the rules, or we should have been advised in the beginning of creating the rules, right? Instead of saying, like, because Dr. Ron Lee's exactly right. Like, how does this pertain to us? How does this, because these are already set, right? And I know that our voices are being heard, but this is where I say, like, as an advisory council, we need to pivot. We need to pivot a little bit about this, because of course, when you're reading rules that I'm unaware of, I'm going to have opinions and thoughts on them. But this is already, we're past the advising part. And so in this meeting, this is the time that the advisory council here is here to meet. Are we advising by being informed? Right? Like, this is the information part of the meeting, where I just, as an advisory council member, I struggle, not that I'm trying to play down, because this is like amazing information that we all need to know. And this is great, but is this the time to be doing this, informing the advisory council about these meetings after the rules are made? As the council, I feel like we want to, okay, Tosh said it doesn't change till October. So if maybe the format was different, like we were read a rule and then what do you think about this? And kind of like you're doing now, but also knowing that as providers or as people with lived experience, we are 100% going to have like things that we want to advocate for, or things that we 100% want to know about for our own agencies, and saying, like, how do we find balance in that? How do we find balance in advising? How do we find balance in worrying about our own stuff that we have out there? Because you read a lot of things that impact the agency that I work for, that I would love to just talk about my agency and what I'm advocating for. But I think as an advisory council, we have a bigger picture here. And so for me, I'm just trying to look at and being clear when this said, these are the rules we're proposing. Does anybody want to say, like, can these rules be changed? Because Tosh said this don't come out until October. So are we saying right now that as you're reading these, we still have an opportunity to change some of these? Because I don't think that, did I miss that, or was that explained right away at the beginning? Because I got lost in there, sorry. But I'm also not there. I had my mute button undone when we started this meeting, so it might just be me.
Dr. Rob, thank you so much for raising the issue. I'll just apologize and say, in all the words I use, I probably don't emphasize the most important part, and that is these rules are in draft form. We've written them in draft form to say, here's some feedback we've gotten, and we've made some changes, and we want to run it by you to see what you think. We are doing this input to see what people think through the end of October. Then we're going to take all of that feedback and make some more changes. And then we're going to go to the State Board of Human Services and or the commissioner probably at the beginning of next year, and then have formal rule hearings. At that point, we will present what is going to be much closer to the final rule. So again, go back. Dr. Rob, if you want us to change a rule, you tell me, and we'll see whether we can change the rule. And so that exists for you as a member of this advisory committee. We're bringing it to you right away at the beginning of the process. And that also is for you, Dr. Rob, as one of our important providers of service. If you want something changed individually as a licensed facility, you tell us too. And you can come into my office and you can give me a call, or you can fill out the written testimony, or you can tell me in this category. We're going to treat it all as critical input and change the rule accordingly. So thank you for raising it. Thank you for giving me the chance to say what is really the most important part of all of the things I'm saying today.
No, thank you, Tom. And I feel like that was a mic drop moment. You just dunked on me, and so I'm good with that's perfect. That's all I want to hear. Like, is knowing that there is an opportunity, and that we're why we're learning this, right? And thank you, Dr. Ronley, for pointing that out, because as she said that, the light bulb went in my head, like, oh yeah, why are we learning about these? Do we still have opportunities? Because some of these, like the background checks, like for providers and everything, that's already gone into place, which I think those are no-brainers, right? But also just knowing like why we're being introduced to this information is extremely helpful. So thank you for that mic drop moment, Tom. I appreciate it.
Good. Thanks for saying it that way. It makes me sound way cooler than I am. And there is a person in this room that can dunk, but it's not me, it's that guy right there.
And let me reiterate for the team, we can send out to you all again the list of where the meetings, public meetings are going to be happening for you to also share out, participate in. And as Tom said, you all are all welcome also to just reach out to him directly, and we can think about if there needs to be any other touch point for you all as BHAAC members before the deadline. And Tasha, if you're okay, can we go to the Q&A question? Sorry, okay.
Yeah,
Tom,
sorry, I'm having problems with mute.
Tom, are you able to see the Q&A question to provide a response, or I'm happy to read it?
I'm scanning through really fast. I'm sorry, I don't think I see the one that is being referenced. Oh, whoops.
Around CSUs and ATUs.
I was in the wrong box.
Yeah, different Q&A.
Thank you very much. Just give me 30 seconds to go through this really quick.
You bet.
I think I understand. So are there concerns with current comprehensive safety net providers shutting down CSUs and ATUs? Whoops, it disappeared right when I was reading it, but I think everyone got a chance to see it. No, we didn't. We don't anticipate that. This is not as a result of providers saying we don't want to provide the service. In fact, it's the opposite. We're getting the interest we were hoping to in more providers wanting to provide both crisis stabilization unit and acute treatment unit services. The issue was really a Medicaid issue about how reimbursement for that enhanced service type was aligning with our approval types. So really that change in our regulation allows a provider to provide that service as an essential safety net provider, which is great because we can maybe bring new providers in that can just do that. And for those comprehensive safety net providers for which it was required, they will also get the essential safety net approval. Now, here's maybe the most important piece of that backstory. All of those current comprehensive safety net providers There are 18 that we've approved in the state. All of them are already essential safety net providers. So that part's really done. Again, this is mostly about making sure that the enhanced money for this important service delivery type flows smoothly and that we have alignment between BHA and HICPA. So thank you very much for the question. Other questions I should answer before we move on the presentation? I'm seeing shaking head. Thank you, Tasha.
You're welcome.
I also want to call out, I think we were anticipating half an hour for our joint presentation. No?
We're good. I think we're on for the rest of the afternoon outside of the public comment section.
Got it.
So we got to make sure we leave some time at the end before we have wraps up.
Excellent. Well, then let's move to the next slide. So what I want to do is get into some of the specifics for the OTP CSL controlled substance license portions of our rules that are changing. And this is really more of the substantive sections of rule that are changing. What I went over earlier, while kind of specific, in a lot of cases were really just technical and minor changes. This one, again, is more substantive based on what happened with our federal partners at SAMHSA. Again, just a little bit more back history here. The reason this is happening is that SAMHSA and all of us were forced into changes as a result of the public health emergency. I don't like to say the word out loud anymore, but we're talking about COVID. What did COVID force us to do? Well, in state government, it forced us to figure out how to do electronic approval of our timesheets. There was a time in state government, we had to sign all those things in ink or we wouldn't get paid. Well, we figured it out in about a week. SAMHSA figured out that we could do take-home dosing and do it in a way that was safe and actually more effective for people that needed that kind of service. So as a result of being forced into some of those kinds of efficiencies, they have now made those changes effective in their permanent rule. So that's just one example of the kinds of things that have resulted in the federal change that we want to mirror in our state change. That's really the top line here of what I'm going to present. Next slide. So again, we got to the rule change as a result of COVID. I actually think that's a little graphic of the COVID virus, though I've tried to push all those things out of my head. Quite specifically, we're talking about the things there on the left-hand box in the federal that were changing reduced time in treatment to receive take-home medications. Previously, you would have to be in that level of service for a certain period of time before there could ever be, regulatorily speaking, the opportunity to even apply for take-home doses. This has been much reduced federally. And telemedicine, which just basically didn't exist federally, is now contemplated for recipients of service much earlier in the process. And we've made these very specific state requirement changes as a result, allowing patients to enroll prior to 1 year, temporary Saturday clinic closures, and then, of course, micro dosing, which leads into that enhanced ability to do take home. Next slide. We got to this rule change because in April of this year, SAMHSA made their federal rules final with those 4 goals that you see listed on the screen as the primary impetus for their change. giving additional autonomy to the individual practitioners or facilities, removing the stigmatization, a lot of outdated language that, in fact, even criminalized what this felt like for recipients of service, a much more person-centered approach, and then just removing barriers to service. If any of you have received service or worked in such a place, the old model was show up there at 6 a.m., wait in long lines, have somebody watch you get the dose, and then you headed out the door and tried to rush to make it to work or catch the bus or get back home to do childcare. All of those things being a somewhat or maybe an actual criminal type model. And I think that we've learned a lot in the last couple of years, and the feds have figured that out. And now we're able to more easily practice that way in Colorado. That's really what we're getting to here. Next slide. And the way that this impacts what we do in Colorado is, well, one, we're aligning with SAMHSA, and we're pleased that they've moved along in this way. We believe that this service delivery model enhances access to life-saving medication, improves people's quality of care, is a harm reduction model, and again, reduces stigma and increases trust with people, meaning they're more likely to seek out, receive services, and then continue on that journey to recovery with us. Next slide. So I want to go through just a couple of the specific changes that we're making within that CSL chapter, but next slide. First, I've left this particular slide in here because I think it's important to say, well, what are all the acronyms we're using in the alphabet soup of state government and regulation? I bet y'all get it, but just in case, wanted to leave that in here, and in particular, if this slide deck serves for a reference for you. Next slide. And then this is basically it, and pretty much wraps up my end of the presentation today. These are the specifics that we're talking about today. So first, in the draft and proposed chapter 13, thank you again, Tasha. The most important part about these changes is that the controlled substance license, when a agency meets the definition of needing a CSL, they will also be required to get a behavioral health entity license. Here's why that is so specific and so important. Controlling how an agency deals with storing, compounding, and administering a controlled substance is one important part of what they do. But we're also saying to that agency, you also have to be licensed to give services for a person that help them on their recovery journey. So that's part of what's required in the behavioral health entity license part, with various levels of ASAM SUD licensing. We've joined those together. We think that's critical. And I'll tell you, we're getting a lot of pushback from agencies who say, sure, I store, compound, and dispense medications, but you can't make me provide these services. And we're saying, yes, we can. We have our attorneys general who say we can, and so we will. And we're fighting with some folks about it. I'll be frank about that. We think it's critical. It's not just about medications. It's also about therapeutic intervention. The second is that we're aligning the CSL timelines for licensure with the behavioral health entity timelines for licensure for the purposes that I just went over in point number 1. We have clarified in 13.3 about what it means to stock medications. it's a term that maybe is somewhat ambiguous. We're basically saying, look, if you keep it on site, and that's part of the requirement to get the license, and then we're quite specific in terms of how it needs to be secured and locked and non-accessible except to a certain few people. And then finally, we have had long reference to medicated assisted therapies in our rules, and those were basically best practice type suggestions in rule. We have very clearly linked those as requirements in the controlled substance license portion of the rules, so that is no longer ambiguous that the agency in question has to provide MAT when it is licensed as CSL. We think that's also best practices, and we've written it in rule. That's also part of what the feds did. I think that I saw maybe a couple questions pop up while I was talking about that, and so happy to take those questions now. Let me say first that this is definitely the area of expertise of Ryan Mueller. He is what is called the State Opioid Treatment Authority. We say SOTA for short, and he is awesome. And so I can only just do a tip of the iceberg in terms of the subject matter expertise on this issue. So if I get questions today that I can't answer, I will definitely connect you with Ryan Mueller. And if this body wants him to come back and do a much more thorough and deep dive into the rationales for this and what the requirements are, he would love to. He loves this. I stole him from Denver Health, where he ran the clinic there. I just can't give him enough praise in that regard. So with that being said, any thoughts or questions about that last part? I'm not seeing anything right now, so y'all survived my presentation, and I think we're ready to move over to Ryan Templeton for system administrative rules.
Do you want to close down your microphone and stuff, and I'll start mine up?
Let's see if I can figure out how to do that.
Thank you, Tom, for your presentation. It was very informative.
Well, BHAAC, I'm Ryan Templeton. I'm Policy and External Affairs Division Director with the Behavioral Health Administration. If you see me looking this way, it really is Tom and I are almost sitting shoulder to shoulder in this room. So if my facial expressions were seen, like, what is Ryan looking at? It was directly at Tom's face as he was talking. So with that, yeah, if you move to the next slide, please. Or I guess the one after this one is system rules. Tom had mentioned earlier, and Dr. Rob, always in my head, slow down, Ryan, right? You're not in a hip hop group here. So if we are, like Tom had talked about, 2 CCR 502-5 is a completely different rule volume than Tom just went over. Tom went over 2 CCR 502-1. That is provider rules. They serve a specific person or specific thing where it's just regulations for providers to meet those regulatory requirements. So within these system rules, this is a much more expansive, this rule volume currently does exist, but it only contains 2 chapters. But what we're doing is proposing a whole new chapter, which is the spot where BHA shares its vision for the behavioral health system. So if we go to the next slide, hopefully this slide explains it a little bit better as well. So the next slide is the overview of the current breakdown of what this rule volume is. With that, we are moving into this volume, a new chapter 1, which is the behavioral health system standards. This is all new content. If you're familiar with what rule promulgation processes, very similar to a legislative process where new language is in all caps. I did not put the new language in all caps because it's kind of hard to read all caps. So if you're looking at the proposed draft of these system rules, they are not in all caps, but chapter 1 is all brand new content. What you take from this BHAAC, I hope you get to there's not a whole lot of content in this new chapter, and that's on purpose. This is setting the foundation that we have to set together. So this is just setting the stage for what we at BHA think this chapter should entail. That's a funding framework. That's how the services are distributed across the state, and that's how care coordination plays into this. There's not a whole lot of content in either one of those sections because we shouldn't be writing these. I joke when I'm at home, I have a 9x9 office at home. There's no reason that Ryan is writing any rules by himself in a 9x9 office in Lakewood, right? So this is where BHAAC, community input, how everything plays into what is our system in Colorado. And hopefully you see some of that in here. So taking Dr. Rob comments about where are we at in this process and how can we actually contribute? And it's just not an informative process. Hopefully this is what really starts to show this is a rule volume that is essentially there to set the stage for what Colorado's behavioral health system actually is. So with that, the two other chapters or the two current chapters in this rule volume are awarding gambling addiction grants and addiction counselor training requirements. We are not making any substantive changes to those chapters outside of the title language and the location. We are making them chapter 2 and chapter 3 because we think chapter 1, the behavioral health system standards, should come first in this rule volume. So there's no changes to awarding gambling addiction grants or addiction counselor training requirements outside of the title language change in location in the rule volume. So if we go to the next slide, why are we doing this? And what sort of authority do you have to do this, BHA? Our authority comes from statute. I like statute, I like laws, and I like rules, which maybe says a lot about me. But anyways, statute allows us, specifically the BHA commissioner has the authority to lead and develop Colorado's vision and strategy for behavioral health for children, youth, and adults, right? So where do we set that? How do we get to that spot of what is that, the vision and strategy? This is where we're starting to set that foundation for where it lives. It's not provider rules. It's not specific to just providers. This is specific to every single entity, person in Colorado that receives or in need of services or provides behavioral health services. This is what the foundation for BHA and that vision is where we start to put that into a format. I liked how Tom talked about this is a iterative process where rules are created with community in a process that is dictated to us by Colorado law. Like we have to have engaging with community to put in their input on what this actually says. And so this first draft, I tried to make it very clear, the draft from 9/16/24 on the top, that is really a first draft. Feedback, we document every piece of feedback and we respond to every piece of feedback and make changes. Over the last couple weeks and months, I've got a bunch of feedback from community being like, if I give you feedback, how are you actually taking that feedback and letting me know that you actually received the feedback and made changes? I like rules because it does that. And it specifically requires us to take that feedback and make changes and tell you, hey, we couldn't do this with the feedback you provided, and here's why. So every rulemaking packet has a section in there, so be on the lookout for that. Really at the end of the calendar year into the 2025 calendar year about what a whole rulemaking packet, and I'd love to come back to BHAAC and talk about rulemaking packets if we want to do that as well. But with that, these rules are different. This rule volume, the 2 CCR 502-5, it is the commissioner adopting these rules. So this is not going to the State Board of Human Services. This will be a rulemaking hearing where we at BHA present this rulemaking packet to the commissioner for the commissioner to adopt directly. That goes back to A there. It's the commissioner is the one that has the authority to lead and develop. So the commissioner also has the ability to promulgate rules or adopt rules. So it's the same process. We'll have a formal rulemaking hearing where folks can come and testify for or against rules, or just be there to experience the excitement that is state government when we go through a rulemaking hearing. And then ultimately, a big foundational piece for what we're doing within this rule volume is also based on statute that it requires BHA to establish a comprehensive and standardized behavioral health safety net system. Where are we putting that? How are we telling all of Colorado what that is? That is where we hopefully can get with this rule volume. So with that, if we dive right into what currently is these 9 pages of rules on the next page here, like all rule volumes, one of the first sections is definitions. Hopefully these definitions, or the majority of these definitions, are not surprising. The Behavioral Health Administration, for instance, that is us, that is BHA, right? That is all of you as well, right? So that's the Behavioral Health Administration Advisory Council, that's part of the Behavioral Health Administration as well. We're responsible for administering this council directly. So that's part of this. Provider rules, what Tom just talked about, that 2 CCR 502-1, that is provider rules. We do not want to duplicate rules in a bunch of different volumes. So we are incorporating by reference the provider rules, saying you can find the provider rules at the Secretary of State's website at this. So that's part of the definition process. Is we don't want to repeat that's in the provider rules, because that just makes it confusing for everyone then. A big piece here is a new definition for the Behavioral Health Administration service population. This is where we're starting to set the what does BHA pay for with the funding that BHA receives, right? We have 29 different line items, but how and what is the strategy for us at BHA to spend that money for access to quality behavioral health services? The last 3 here, Behavioral Health Administrative Service Organizations, BASOs, as well as Behavioral Health Safety Net Service is a statutorily defined term, which we use throughout this volume. And also the last one here, Emergency or Crisis Behavioral Health Services, is a statutory utilized term here. So those are just the definition sections. Don't want to put too much time in there and actually get into the content of these rules, which is starting at the next slide. So in chapter 1 of this rule volume, the subpart 3 is BHA's service funding framework. So the first part, what does BHA funding pay for? In general, it pays for available and timely access to quality behavioral health services. You could be asking, hey, Ryan, what does that actually mean? And I think that's a legit question that we are currently working on, what our framework actually is and does. One thing we did put in here is that BHA is allowed to and should be allowed to support behavioral health service access by any means appropriate, which includes, but is not limited to, the ability to pay co-pays and deductibles for behavioral health services rendered. Current law prohibits third-party payers to pay co-pays and deductibles for individuals with health insurance, but there's an exception in statute that allows for mental health services to be for co-pays to be paid for. So we are leaning heavy into this, is that BHA should be able to pay for those things as well. That's one of the more, hey, let's put it out there and see what happens within this as an opportunity. So part B and C here is where I think BHAAC, the Mental Health Advisory Board, the Children, Youth, and Families Mental Health Advisory Board, and all of our approach to how we engage with community really need to influence how services and are paid for priority populations, which is a statutorily defined term, 2 separate and different definitions in statute about what is a priority population. Community has to help us influence how we pay for priority populations, what are priority populations, and ultimately how do they access services. So there's not a whole lot of content in here, but we are acknowledging that priority populations are a big part of what the Behavioral Health Administration is responsible for, as well as an acknowledgement that the Behavioral Health Administrative Services Organization, or the BASO, and their regional subcommittees that they are required to create with the Behavioral Health Administration help to identify and influence funding for underserved communities. We did not identify what our priority populations, we did not identify what our underserved communities, as the communities themselves have to tell us what those underserved communities and priority populations are. So this is where I talked about earlier. This is really just setting the framework and foundation for what this rule volume is. And there's a lot of content that we need community to weigh in on and help us establish what the actual, put the meat on the bones for this rule volume. I will stop there for a second and look through chats here. Yep, so I think we're some insurance and healthcare policy and financing Medicaid. This is one of those ones where, yes, I mean, this is setting that foundation for how does a pretty big insurance provider, we could say, Medicaid, also plays into the behavioral health system. Right? So we are really trying to get this as the, hey, this part or this chapter 1 of these rules is really where we can promote service alignment across systems, including with healthcare policy and financing, as well as other state agency programs, right? I think we've talked about 14 or 15 different state agencies or state departments run behavioral health programs. Like, hey, we are now have a place to reference what our system actually is when we work through formal agreements, for instance, or set up contracting requirements for those. So here's an opportunity that we see as how can we be a transparent state agency. So if we move to the next slide, I know we're getting close to time here. If we move to the next slide, yep, network adequacy standards there. So this is where the BHA is required to establish and assess what types of behavioral health services are provided on a community, regional, and statewide basis. This is a foundational piece about state statute, or the state law requires that safety net services mean these 14 different services. Those services need to be distributed on a community level, a regional level, and a statewide level. And if we work backwards, statewide services, we kind of generally know what statewide services are available to everyone. Across the state, there are 2 types of statewide services we have identified in this rule volume. 988, the statewide crisis hotline, as well as the services provided at the 2 state hospitals, the state hospital at Fort Logan and the state hospital at Pueblo. Those are statewide services and the only 2 statewide services. Moving backwards, regional services, regions are our behavioral health administrative service organization regions. There's 4 of them across the state. And that those regional services we are saying are walk-in services, or mobile crisis services, or the hospital alternatives, which are the CSU and AT, or crisis stabilization unit or acute treatment unit services, as well as respite services, withdrawal management services, residential services, and inpatient services. Our rules do not dictate how many or of these services are happening in each one of those regions, as that's what contracting is for, and that's what funding pays for, right? So this is that, hey, Ryan, there's not a whole lot of meat on the bone in this section, and that's on purpose, right? Where it's how much money do we actually have to promote these types of services, but we're setting the foundation for saying our regions need to at least have these things to make sure that there is access on a regional basis to certain types of services. Going fully backwards, the community safety net services. Community is not a statutorily defined term for the Behavioral Health Administration. So we said in this rule volume, or this first draft of this rule, is that community means a 5 county categories: large metro county, a metro county, a micro county, a rural county, and a county with extreme access consideration. If you're thinking, wait, I maybe have heard this before, our friends over at Healthcare Policy and Financing, through their regional accountable entities, this is how they are breaking down their requirements for Medicaid and how they deliver Medicaid services in communities through their RAIs, or regional accountable entities. So this is where hopefully we can start seeing there's a little bit of an alignment between systems that maybe we haven't really had before now. So that's where that comes from, but we will also are fully open to feedback about what community actually means. And opportunities for updating future drafts of this as well. I will say community then and the services in communities based on those regional or not the regional or the community or county definition there is outreach, education, engagement, outpatient services, integrated care, care management, high intensity outpatient, recovery supports, or recovery services, care coordination, screening and assessment, and outpatient competency restoration. So those are services that should be available in counties based on a county designed, like how big a county is, what kind of county classification is. We're currently working on a map that would hopefully provide a little bit more context about my county is this. So we'll hopefully get there shortly. But I see Jamie's hand up.
Hi, Ryan. I think that this is a good one that would be really important to make sure that we circle back on after the rules are drafted, and this has kind of been implemented for a little while. I know with network adequacy standards as previously defined by the ACC 2.0 contracts, did not necessarily, it met the letter of the contract, but it did not necessarily meet the needs of the communities. So while really the Rays did what they were supposed to do and set up their network appropriately, it didn't mean that the services were actually being provided seamlessly, efficiently, all the things. So if I don't know if that would happen at the regional subcommittee meetings or at some point with healthcare policy and financing to really circle back and say, okay, here are the standards that were set. Here are the defined community, areas. Are people actually getting the services? And are we meeting the mark? So I just wanted to flag that for future consideration.
I think I am so impressed with councils like this because of questions like that, right? I think this is exactly where we can lean heavy into this group about the experience that each one of you have had within this system and what has worked and what has been just maybe it's just barely meeting the letter of the law, but how can we actually produce better access to quality services for everyone across Colorado? I think you're exactly right. And I do not want to downplay what Tom had mentioned earlier is that BHA can no longer just draft rules and put them on a shelf. This needs to be a full iterative process that is updated and reviewed at least annually. And this is a process that, I think there was a question earlier about how often do these things actually get updated and what sort of feedback actually dictates when a rule is updated. That's what you all should be telling us as well, where it's like, hey, system rules are this, and we need to change it this way because we have this new information. Right. So I think that's our next opportunity with groups like this, as well as all the other community engagement opportunities and having a true community engagement strategy with how is it not make sure that it's not just Behavioral Health Administrative Advisory Council or BPAC, but how do we fully engage with communities that are out there? And it's not just a regional subcommittee piece either, but it's all communities having an opportunity to weigh in on what we're doing. And part of what I'm also excited about here, which is a lot of things, I guess, right, is our performance hub, right, where it's how are we actually having a data-driven approach to how we are responding and making corrections to a system to make it better informed and provide the services that we are actually looking to provide for the people of Colorado. So thank you for that, Jamie. Thank you for your participation in meetings like this and a whole lot of other meetings as well, which we would need to be able to utilize all of the expertise that is provided to us in a meaningful way that shows that your input is providing change.
There was a question about how we measure progress. I think you touched on it briefly with Performance Hub. Any additional expansion you want to give on that?
Yeah, I think that's also a fantastic opportunity to come back to this group. How are we measuring it? How are those dashboards being presented? How are those dashboards being used within the Performance Hub? Are we measuring the right things? I think that's a larger conversation, which is also a really good one to make sure that we have that as an ongoing, agenda item for BHAAC. But that's what I hear is chair and vice chair, congratulations to those appointments this morning, if I heard correctly, as an opportunity there to really work on what does agenda setting look like on a more month by month, every other month process to make sure that you all get what you need early, so then it isn't feeling like it's just state staff, Tom and Ryan coming in just blurting out what's already happening. That is not the approach that we want to be taking with our advisory councils either. Going to the next slide, as I know we're running short on time here. Last section of the chapter, or this chapter 1, is about care coordination. This is the actual language of this section, is that we're just putting it out there that the behavioral health system must have the ability to respond to inquiries related to where and how to access any type of behavioral health safety net service, right? Just sending it out there that care coordination plays a piece in that. Statutorily, we at BHA are required to credential care navigators. So we're saying that those care navigators need to be available at all access points within the behavioral health system. That's the piece of there's a statutory piece. This is putting it out there that that's part of the care coordination infrastructure, as well as this is where the reference back to the provider rules that Tom talked about earlier, is that providers have specific care coordination requirements. We are not going to say those in this rule volume because that already exists in the provider rule volume. So that this is where that incorporation of reference would come in, that if a provider is providing care coordination services, those specific requirements for providers would be found in that other rule volume. I blew through that system. This is also another time to plug we have in-person and virtual community engagement events for rules. So if you want to go deeper dive, definitely attend one or all of those with us as well. So I think it goes to a questions page next. Is there any questions about this, as we still have one rule volume?
It looked like Catherine asked and Tosh A reiterated list of those services. And then what services are we talking about? I don't know if you want to give a list now or send separately.
If I can, I will send it separately. And this is a good reminder, is Ryan had a slide about that, so then you can see it in writing as well. So thank you for that. And we'll make sure that that gets out to this group as well when we get slides updated.
Thank you so much, Ryan. Appreciate it.
So the last section here, I know we're really running out of time, is administrative rules. This is another different rule volume than what Tom talked about, what I just talked about. This is 2 CCR 502-6. This rule volume also currently exists, and the current only chapter in this rule volume is about the form and manner to apply to be a BASO. So state law, state statute required BHA to promulgate rules on the form and manner to apply to be a BASO, which is through an RFP process. In short, what that chapter says, we're not changing any of that chapter, but we are adding a chapter 2, which is the system of care for children and youth. This is all new content based on a bill from this last legislative session, House Bill 24-1038, which is that chapter 2. Yep, this goes directly to State Board of Human Services, not to be confused with 2 CCR 502-5, which are commissioner rules. And it's more similar in that manner to Tom's provider rules. It will be a hearing at the State Board of Human Services once there's a final version and a rulemaking packet gets created. Tasha, I'm going to look for you. There's a few slides related to this. This might also be a good opportunity to bring the subject matter experts on this rule volume back to BHAAC at a future date to go through those detailed pieces, as I know we're getting close here.
That is great. I think I was going to say if we could put that on the table for to have them come back and circle around, because yeah, this is a lot of time with all this information. My brain's all mush. How about everybody else's? So Yeah, I'm just saying, and I read them all. So we appreciate you guys. So let's put that on for a later agenda date, if everybody agrees with me on that.
And this is another one. I want to reiterate that we go into detail about all of the sections. It's only 3 pages in the rule engagement meetings that are virtually and in person over these next 5 weeks. So please attend those if you're interested in getting more detailed information. I think Matt is actually meeting us up here in the next hour or so as we're in Fraser Library today. So that's also, putting that out there as more opportunities to make sure that you are connecting on the details of these as well.
Absolutely. Can I suggest that an email be sent out directly for all advisory council members, just to assure that we don't get everything lost and shuffled and forget, because we know how busy our schedules can get. I know there is access for public on that, but for us advisory council members.
You bet, Tasha. You bet. Caitlin
Thank
and Megan
you.
will send out a separate email, is what I'm hearing, that's titled the rules, meetings, and make sure that you have what you need for your dates. Thank you.
Yes, so we can all get our schedules worked around there and get our input in, because it is important. And also the people of Colorado, all the people of Colorado. So yeah, thank you. Are we done with this section? I don't know. I don't have the agenda in front of me. So we're on to
Yes.
public. So I want to thank Tom and Ryan for presenting all that good stuff to us today. I greatly appreciate it. And yeah, hope to see you guys back here soon on our agenda so we can readdress and connect and stay all on the same page. And then I think we move on to public comment and questions. I don't have the agenda right in front of me, so I'm winging it.
You're fine, Tasha. Yes, we'll open the floor for some public comment now. So if you want to come off mute, we'll be able to disable that. Please just raise your hand or message in the Q&A so we can unmute you if you have anything that you would like to ask or say.
And we limit talking to 2 minutes, correct?
Yes. Thank you for that,
Yes,
Tasha.
I remembered. Yay. So we're going to open it up.
All right. Give me 1 minute, Lindsay. I'm going to unmute you. All right, Lindsay, you should be able to speak now.
Wonderful. Thank you so much. My name is Lindsay Simbe. I work for Velocity Bio Group and HICMA. I wanted to reach out to you all to understand what has been discussed with regards to the changes in the bulk purchase fund with CDPHE and how the change to the standing order capping naloxone access at 4 milligram is impacting the BASOs and what they can then provide across the state. We're increasingly hearing concern from stakeholders, especially those serving our youth organizations and our rural communities, about the limitations of not being able to have access to all forms of naloxone, and wondering how you all are addressing that or how that's impacting the work that you're doing.
Great question.
That is a great question that I can't answer, Lindsay, but wondering if Ryan might be able to, but if not, or Tom, if there's another BHA staffer that might be able to, but if not, Lindsay, we will be sure to capture this and get back to you. But let me give Ryan and Tom a chance, or someone from BHA.
Yep, Lindsay, thank you for that question. I wrote down your name to make sure that you connect with our our statewide programs team, Mark Johnny leads. I don't know who's actually assigned that position anymore. Or it was Danielle Culp with the bulk purchasing pieces, but I'll connect with you to make sure that we get that information and then get that information back to BPAC or BHAAC as a whole related to what the specifics of where we're going and what we're seeing within that. I think you bring up a lot of really good points about, hey, what are we doing with this, and making sure that people have access to the services that they need, including medications and a whole range of different types of medications as well. So thank you for that. Like I said, I'll be reaching out to you and connecting you with Mark as well.
I really appreciate that. Yeah, we're just hearing with some of those changes that a lot of people are lacking access, and I'm curious how that's going to then impact demand that people are accessing then through the BOSSOs and the BHA, because my understanding is that a lot of people have a secondary access point through the MSOs or what used to be the MSOs. So just curious how that's looking, and also how we're taking into account feedback from community members and what the state and our community members want and need, because I think a lot of the changes that were made at CDPHE did not take into consideration community feedback and stakeholder feedback.
Lindsay, thank you.
Yep.
So Ryan will follow up to you personally, and then BHAAC members will include the response on that within the notes so we can have it documented. Thank you.
You kindly.
Thank you, Lindsay, so very much. Appreciate your points that you bring to in this meeting. So appreciate you. Any other public comments? How many more minutes? What's my time? 5 minutes, I think. I'm trying to keep time to it all. Ooh, how do they do this? Anybody else? Any council members? Any questions? Any comments? Anything from our council members? Public? Oh, there's a question in the queue. Okay. Oh no, that was just, thank you, Lindsay. So I'm gonna take it nobody has any input or anything else to say or comment or questions. Can I adjourn early so we don't sit here in silence? All right.
Yes, you can, Tasha. We just need the motion.
All right. Do I motion it?
You can start the motion, yeah.
Okay, I put the motion to end the Behavioral Health Administration Advisory Council meeting for 9/19/2024. I don't know what time it is.
11:56.
11:56. Do I have a second?
I second.
All right, meeting adjourned. Where's my gavel? I don't have one, but we need one. Bye, guys. Have a great day. We'll be in touch. Bye, everyone.
Thank you so much, everybody.
Thank
Have
you.
a great rest of your week.